Today is the day Republicans will take action, they say, that will eventually replace Obamacare. Republicans vow to repeal the measure President Obama signed into law back in 2010. Georgia Congressman Tom Price, member of the Congressional Health Care Caucus, the Doctors Caucus, and chairman of the House Budget Committee. How are you, sir? And welcome back here to America's Newsroom. Happy New Year to you. You know, Republican voters are saying, they've been saying it for 6 years. What took you so long?
Yeah, well, this is really an important event this week. For the first time, we're going to be able to have a bill passed through the Senate and the House, get it on the president's desk, that repeals Obamacare, that fulfills our responsibility to represent our constituents and recognize what they know, and that is that this law is not only harming the health of so many Americans in many, many ways across this country, but the health of our economy. And so what we'll do is put this bill on the president's desk that will repeal Obamacare, and we'll let the president then say whether or not he stands with the American people or whether he's getting in the way of positive solutions.
So you know what he's going to do, right? I mean, it's a foregone conclusion. He's going to veto that bill. So then it's going to bounce back to you yet again on the idea of what you replace Obamacare with. And that really is the linchpin for this entire debate. What will Republicans do? What will they fashion in terms of a bill that replaces Obamacare? What does it look like?
This is why I'm so excited about the new leadership of Speaker Ryan. What he has done is charging the committees in the House of Representatives that work on health care to come forward with a positive solution, a common sense solution, a patient-centered solution that puts patients and families and doctors in charge of health care and not the federal government. And we'll do that over a period of a number of months. This isn't going to be a top-down like Obamacare was. This is going to be a bottom-up, an organic process that brings together over 100 pieces of legislation that are currently in the House of Representatives that deal with health care and comes forward with those positive solutions that recognizes the principles.
And as a doctor, and you and I have discussed this for years now, okay?
Right.
What does it look like? How is it better?
It respects the principles that are violated by Obamacare. So accessibility for every single American, but not a mandate that dictates to people what they've got to buy. Affordability, the cost of health care is skyrocketing. We need to bring those costs down. Incentives for the highest quality of health care in the world, and the quality is being harmed by Obamacare. And then choices, the incredible amount of choices that patients want. They want to be the ones that select who's treating them and where and when and the like. And so it will respect those principles. And when you look at those principles, then you can figure out exactly what the bill ought to look like. And that's what we'll be doing through our committee process.
Okay. Now, how long does that take?
I think it'll be a number of months, but as I say, I'm excited about the Speaker charging the committees with the responsibility to bring this piece of legislation forward. The fact of the matter is that there are over 100 pieces of legislation right now in the House as they relate to health care. There are a number that are comprehensive and would address the challenges that exist with Obamacare, which have violated all of those principles. So I think it's a number of months that we'll work through over the beginning part of this year and have a piece of legislation that we can be proud of and that the American people can point to and say, those are the folks that we want to be in charge of health care policy.
Last question then here. You know what the Republican electorate and a lot of independents have been looking for. They've been looking for something that gets away from Obamacare because they don't like it. And they've been waiting for folks like you to give them an option, to give them an alternative. And that's what they've been saying in vote after vote and cycle after cycle. And they've gotten nothing. What will you tell them now about what their expectation should be?
That's why this step this week is so important. Remember, this is the first time that the Senate's been able to act with just a simple majority. Usually the Democrats stand in the way and it requires a 60-vote threshold. So that's why this week is so incredibly important, because it's the first step in the process then that will allow us to bring forward that replacement piece of legislation. I'm so excited about the opportunity that we have. And again, nobody's living under the illusion that the president's going to sign this piece of legislation. But it's so important for the American people to know that there are folks fighting as hard as they can right here in Washington, D.C. for them and for a positive solution in the area of health care. The president's been getting in the way. We want positive solutions.
Today again in a line, what happens?
Actually, it's tomorrow. Today we'll bring forward the legislation through the Rules Committee, but tomorrow on the floor of the House we will pass the reconciliation bill. There will be a bill to repeal Obamacare in its entirety, put it on the president's desk.
All right, we're watching. Didn't mean to cut you off. You get to finish your sentence there, but today out of committee, tomorrow the vote on the House. Thank you, sir, very much. Tom Price, the Republican from Georgia, thank you for your time.